Good evening, everyone. A warm welcome to this special session on diabetes. And not only that, these are some small challenging sessions. Other than that, sir will be introducing us with basic sessions and all the upcoming sessions from sir in the future, whichever are there, will be introduced today, and also some more techniques to heal ourselves in certain situations. So let us get into the session with no further delay. So I pass over the session to sir. A warm welcome to you, sir. Good evening, sir. And a heartfelt gratitude from all of Joshi's Kerala group members for this session. Thank you, sir. Please take over the session.
Okay. Okay. Good evening. A very warm welcome to all members of Joshi Kerala Group and to Joshi sir and Arusha madam personally, and to all the team members who are working behind the scenes to make this an exciting event for each and every one of us. So as we have been seeing a number of different types of points, etc. And last class I have told you where all we can use all these points in a constructive way. And I am very happy that a number of people have benefited by some of my treatments, and then they have specifically mentioned the treatment, and they have also told that they have got benefited. And of course, of great use is the serotonin treatment. So today, we'll be covering 2-3 different things. First, of course, we'll go about the basics of diabetes, just very basics. All of you know about it, I know. Just the very basics, how we are tackling, how we are using certain points specifically to improve the certain functions. So this will be one aspect. And before that, we have got what is known as a diagnostic chart of pain points. So this diagnostic chart of pain points is really the fundamental diagnostic tool for everybody who wants to learn neurotherapy. But it is just the starter. By itself alone, it cannot be, it is not to be taken only alone. And the example I give is that of your, in kitchen, the masala box. Okay, the masala box contains very various items, which unless and until you know how to mix those items, you cannot prepare a successful dal or khichdi or whatever. Of course, you can still use them. By trial and error, you may even learn many things about it. But then if somebody gives you an exact knowledge of how to use those diagnostic points, and of course, naturally prepare more, many more will come in the way. Like that, this is the way I am going to take you through this exciting journey. So we'll be talking about the pain points. I'll be showing you some chart. Then I will correlate that chart with the pain in various parts of in and around the navel, whichever is very essential for us. So that way you will learn that this is not something where we are talking just like that. You will learn that it is quite scientific. And the moment you understand that it is quite scientific, your interest will be kindled to know further. And then we will talk about the courses, because we have got 5 levels, and we have got a basic course and an advanced course, and we'll talk about that. I'm sorry, I couldn't see that. Okay, we'll see that later on. 1 minute. Joshi sir has written something. So something was missed out because the camera is pretty far away, my mobile. So Next time, please, sir, whoever wants to write something, put it in the chat, and then I will, at the appropriate moment, I will look into it. Okay, so this is how it will be. And then, of course, later on, we will have question and answers regarding the course, regarding whatever to be done, everything. Okay, so this is how it's going to be. And this is diabetic challenge. What we have for you is, I need people who are just maybe 2 to 3 years into diabetes, not people who are 15 years into diabetes. For them, the challenge will take longer time. Why I say 2 to 3 years is because then for such people, within 8 days or 10 days, I can show results, which you yourself are going to say, I am not going to be there present. You are going to monitor your blood sugar level. You are going to monitor what are the symptoms which you faced before the start of the treatment, and then what are the symptoms which have reduced as we go through, symptoms which reduced, and then whatever benefits you get, you have to put it down in the group, and this will be a special exclusive group for this purpose. And then we will present these things to you, to all your members, so that everybody gets benefited. But first we should get the results, and for that what I require is people who are 2 to 3 years into diabetics. They will be the ideal. Even other people will get benefited. I'm not saying that they are not going to get benefited, but since diabetes is also it's a metabolic disorder, so that means our metabolism keeps modifying itself, and it affects so many organs, the kidneys, thyroid, so many things are getting affected in diabetes. So for that reason, I say the 2 to 3 years means the number of affected organs will be much less. So then it is easy to show good results. So this is the basic contention. Okay. So now we will just go to I am going to share this thing for you, one chart for you. Okay. Okay, now I will just give me a few seconds. I will share this. Fine. Now, here we have seen this chart earlier, but here I am now going to explain in greater detail, and then tell you why and how this chart is going to be of use to us. So here we have got now here we have the thyroid gland, and I have showed you how this is to be stimulated. In diabetes, this is a very useful gland to stimulate mildly. Then here we have the thymus. In diabetes, we don't normally stimulate the thymus because diabetes in many cases is supposed to be an autoimmune disorder. And what happens in an autoimmune disorder? In an autoimmune disorder, the thymus gland makes certain cells called T lymphocytes. And those cells are meant to protect the body, of course. They are meant to attack only invaders. But in autoimmune disorders, these cells become like the rogue elephants. They start attacking the body itself, certain cells of the body. And in diabetics, they attack the insulin producing cells of the pancreas, that is called the beta cells of the islets of Langerhans. So they attack that. So that is why normally in thymus normally in diabetes we don't give thymus. But in its place, we have got another treatment which is given on the back. That I will show you a video how the treatment has to be given. So that is one point which you require another person's help. Okay. Now this is the end of the sternum, and this is where you can also call it the solar plexus. And see, you can here see 1, 2, 3. This is, you see here 3 points, and here actually here in this tip of the sternum, just over here, we have the pain of pancreas point. And most diabetics will have a pain here either after touching or without touching even. There will be a pain over here, and that pain will be removed by our pancreas point. But just as in cooking, you cannot use only one item, too much or too little of it alone to get results, isn't it? So similarly, in diabetes also, we have to use this pan along with many other treatments, many other points. And then it will give very good results. Okay, then this we have already seen is gas, the pain of gas. And the first 2 points, they are called gas only. That is the pain, that is the points associated with belching, with stomach irregularities, stomach indigestion, etc. They will be here. So this pain will be between this region to this region. And here below it, you have got point number 3, and that is the point associated with intestinal gas or flatus. So intestinal gas or flatus, it is a small area, whereas this is a bigger area. And for this, I had told you that day, mentally we will take this space and divide it into 3 parts. So 2/3 of that is for gas, and 1/3 of it is for the intestinal gas. So this is for the stomach gas. Okay. Then here we have point like this, 1, 2, 3. These are the pain of the gallbladder. So anybody who has got pain in these regions, you should understand that that is associated with the gallbladder. And this side is associated with the spleen, which in autoimmune disorders also, we normally don't stimulate spleen except when we see pain over here. For example, there is one ailment called splenomegaly. Splenomegaly. Megaly means huge, mega mall, huge. So splenomegaly means the spleen that becomes bigger. Like hepatomegaly, the liver has become bigger. So splenomegaly. So this splenomegaly, this pain, there may be pain in any one of these 3 points. 1, 2, 3. So in that case, if it is there, then we can remove it by proper treatment. We have got treatments for that we can remove it. Otherwise, in diabetes, we may not give this spleen point unless essential. Okay, some diabetics may have pain over there. So as long as the pain is there, we will give it. Okay, then this is the navel, and exactly behind the navel on the back is L3 vertebra, 3rd vertebra, lumbar vertebra number 3. Okay, and approximately behind this region over here, behind, you will find the adrenal gland, and that will be stimulated. That is a very useful gland to stimulate in diabetes. Okay, so that is approximately behind this region, somewhere around here and here. Okay, we will be stimulating it in 3 points as per the video which I will be showing later. Okay, then the pain of the ovaries. is approximately, I think I have already discussed this last week. So I have said that mentally imagine a line from the navel to the middle of the groin. This is the middle of the groin. So mentally imagine a line from around that, and then approximately over there you will find the pain of the left ovary. And this left ovary pain point is a very, very, very useful point for diabetes. And we have got many techniques to stimulate it. We will, as and when it's needed, I will teach you those points. Then here is the pain of the right ovary. Some diabetics who have high blood pressure also may have this pain over here also. So in that case, we will teach you how to stimulate it. Then here we have got 2 points. They are of use. This point is called acidic condition of the body, of the blood, and this has got nothing to do with stomach acid. Stomach acid is hydrochloric acid, which has got a different function, whereas this acid, we call it the acidic quality of the blood. And for people, diabetics, since they are constantly passing urine, drinking water, passing urine, drinking water, passing urine. So what will happen is that this point may have a pain, and that is for removing it, we have got certain points, okay, which you will see in subsequent classes. Actually, I will require a few classes for diabetics exclusively. So we are discussing it with Joshi sir, and then we will announce it for all diabetics. Okay, so then acid point also, it will be given as and when required. And this alkali point or fluid point, this is normally associated with stiffness or rigidity of the body. So when the body is stiff, for example, in spastic cerebral palsy, the body becomes very stiff. So for such children, they may have pain over here in this region. One second.
We request everyone to please make notes. That is very important. And please listen to this session very carefully, because this session is the free session. And upcoming, we have a particular session for this diabetic challenge. So please listen to this session carefully. Thank you.
Yeah, thank you. So we said gas only, gas, this is called gas I for intestines. Then we have got left ovary, we have got right ovary. I said left ovary is very much important for diabetics. Right ovary for diabetics with high blood pressure. Then we have the liver point. The pain in the liver is manifests over here. Though the liver is inside, the liver is in this region. Please remember, I again and again repeat, when I say liver pain point is here, anatomically the liver does not exist here. Actually, here you are having the intestines, the jejunum and ileum, but the pain point, it is called the referred pain. The referred pain of liver will be manifesting along this horizontal line. Okay, and here again, this 1, 2, 3, what they indicate, I will be teaching. These indicate the position of giving the treatment. For example, that means the correlation. For example, you all know that in liver, we are giving treatment first in the left hand and left thigh together, in the first location, then second point in the middle of the hand, middle of the thigh, simultaneously. Third point is middle of the, near the wrist and near the kneecap. So this we know. So these 3 pain points, these 3 places correspond to this 1, 2, 3. So you understand? So that means 1 number pain will go by pressing here and in the liver, near the groin. Okay, 2 number pain will go by pressing in the middle of the thigh and middle of the hand, forehand. And then 3 number pain point, which is farthest away from the body. So it will be here. And you see it is a small area. This is a bigger area. Okay, so the pain here, to remove this pain is easier. To remove this pain takes slightly longer time. Okay, because this area is very small. Even in the thigh, as we are approaching the knee, the kneecap, as we are approaching the kneecap, the area becomes tapering. You understand that? So this is how that is why this place is, the pain in this place takes long time to get healed. And many diabetics believe we have pain in that region only. Okay, so they have pain in this region, and it's not so easy to remove. It keeps problem. Okay, and this side pain, which is also of course associated with diabetes, is the pain of what is known as pain due to mucous membrane inflammation. And many diabetics have problem in problem with constipation, and for them this mucous membrane pain will be there quite often. And for this we have got 2-3 different treatments. Okay, so we can say that for this, even here, the right hand near the elbow, then middle point, and near this thing, and simultaneously the right leg, right thigh, that also treats mucus. But we don't use it only that alone, because that has got certain other, let us say, additional effects. And so we don't use it alone except when needed. But we use other treatments like 30 medulla, etc., to remove that pain of the mucus. And the pain of the mucus is also again felt like this. Okay, and this 1 number over here means the pain will that is this associated with the pain near the elbow. Then 2 number pain is associated with the point near in the middle of the arm, and 3 number is near the wrist. So like that you are seeing the correlation. Okay, so now we have covered all these points, and of course behind here, this is the mucus. Behind mucus you have what is known as mucus zero pain point, and that is very much associated with diabetes. So the mucus zero pain point, for that the treatment is different. Okay, it is not mucus, it is mucus zero. And when I say mucus zero, it is very much involved with the left kidney region, circulation to the left kidney region. We have to increase, then the diabetics get benefited. So all these things, of course, many of these points you may be treating with your other methods. I don't deny that there are many methods to treat it. Our method we are going to teach you, that's all. And again, I repeat, and I will be repeating this often, if you are going to take neurotherapy treatment, then at least 1 day before it, you do not take any other treatment, because this is also working on subtle energy fields, and all your other treatments like acupressure, acupuncture, single point treatment, all these things, they work in the subtle region. So 2 subtle regions, subtle warriors should not be at loggerheads with each other. Sometimes they may benefit, but quite often they may not benefit. So again and again I am requesting, please, with a big capital please, do not mix acupressure, acupuncture and neurotherapy on the same day. Both therapies have got their great plus points, but do not mix it on the same day. And this is something which by this thing also, experience also, we know that it does not always help the patient, and sometimes it may go the other way also. So do not mix. Okay, so this is something which you have to take into account. Every therapy has its plus points and has its restrictions. One of the restrictions for neurotherapy is you can take allopathy as much as you like, no problem. But if you want to take any other natural method, please do not do it on the same day along with neurotherapy. Okay, so now we have seen more or less the approximate pain points. Now here I am going to show you another chart where you get better correlation. Now, as I said, this pain point, this is the left leg. This is the right leg. The patient is lying. When his face is up, that means this is his left leg and this is his right leg. Okay, so the first point over here, that is the point which will be with the right. This is only the right thigh. Sorry, only the left thigh. So the first point will be over here, the pain over here, pain of gall, when you are giving only over here. And similarly, when you go to this last point here, the pain of gall, I am giving treatment only at the end. That will remove this pain point. So first point of gall pain will be removed from here by pressing only on the thigh, the first near the groin. The last point over here I am showing, that is by pressing, it will pressing near the kneecap, the left kneecap, near that, and that will reduce the pain of this region. Okay, okay, yeah, this is right and this is left. Wonderful, thank you, thanks a lot. Okay, now again we are coming to another, the right ovary, left ovary region. Now here you can see this side, the last point here, the last point here and here. That means very close to both the elbows. When I press simultaneously over here, the pain, it will reduce the pain in this region, the nearest to the perineum. Then again, when I press here and here, this will reduce the pain nearest to the nabhi, the navel. And of course, the middle point will be for the middle point. Okay, so these 1, 2, 3, 1, 2, 3 means 1 and 1 to be given together for WD, 2 and 2 also together, 3 and 3 also together. So like this, we are having this correlation, and this correlation, I am giving this to you. Of course, this will be covered in our classes extensively, but I'm telling this to you that all of you should understand that how closely neurotherapy treatments are linked to the body physiology. Understand? So that's why I'm giving these two charts are there only to help you to understand how there is the correlation of the pain in the body to the different pain points. And now we will see one more chart. Here is a chart. This is a very common chart. Many people will be knowing this chart, this type of a chart. This one. Okay.
Disabled annotation, sir?
Yeah, no, finished. I'm sharing again. No, somebody had made some drawing which was not needed, so I just removed it. So, because otherwise People will start resume share. Okay.
So disable annotations, sir. That will help.
Yeah, that's what I was locating. How
Oh,
to disable the annotation for others? That I am unable to get. I am able to
uh,
get clear all drawings.
while sharing, you'll have a bar over there on the
No,
top.
I got the annotation toolbar. I got the
Yeah.
toolbar, but I'm not able to get disable that function. I'm not able to get. Wait a minute.
Actually, it will be in more.
Oh, it will be in more. Right.
Yeah.
Okay, yeah, disabilitation for others. Yeah, that's right. Thank you. Okay, fine. So now here you can see this is the scapula. Okay, one side has been shown. Okay, and we'll be using this also for our this location for our ADR treatment. So now adrenal, it's called adrenal treatment. Now this is the upper shoulder blade pain. Upper shoulder blade pain can be there over here and also of course over here. I'm showing only one side, but upper shoulder blade pain can be on both places for diabetics, because in diabetics they have what is known as peripheral neuropathy. What is peripheral neuropathy? Peripheral neuropathy means it is the nerves at the extremities. They are not able to get proper message from the brain, and normally it means our fingers, our toes, but naturally these are the peripheries which of the limbs, but otherwise the periphery on the all over the body is the skin, so that's also a periphery. So that is why the diabetics may have a lot of pain in various areas of the body, and that also may be aggravated by gas, etc. So that is why this peripheral neuropathy is a very irksome customer. No, it's not easy to tackle so easily. So sometimes it can manifest as skin disorder, sometimes it can manifest as a tingling sensation, scratching sensation, itching sensation, burning sensation. So all this is, in fact, we have found out that burning sensation is invariably associated with the lack of vitamins like B12, folic acid. And you all know that in diabetes, diabetic patients are given a tablet called methylcobalamin. All of you, I'm sure you know about it. That is one of the forms of vitamin B12. And if it is given, it helps to a certain extent, but then the pains may be there. I'm just giving you an explanation why the pain in the various parts of the body is happening for diabetics. Okay, so here you can have pain due to cervical region will be manifested in this region. This is called the buffalo hump. If all of you just make your head down, then just behind you will see one bone which is slightly coming out, and that is called the buffalo hump. I mean, the buffaloes have a hump like that, no, over the neck, like that. That's why it's called buffalo hump. Okay, so then if you the pain due to spleen disorders, this is the left side of the body now. Earlier this was the right side of the body. This was the right side of the body, this is left side. When the person is facing you, this is the right side of the body. When the person back is turned, this is the left side of the body. And so left side of the body will feel a pain. This is the region of the spleen. On the other side, we have seen it. The region of the spleen is over here. See, over here. So behind this is what the point I am showing you, that is here. So the pain due to spleen disorders. Okay, and the center, the solar plexus region, that is where the pain of the pancreas, approximately T8 region, that is the pain of the pancreas. And then this is the right kidney and pain point, otherwise known as liver 0 pain point over here. This is the liver 0, the right kidney. Behind it on the other side, you have the pain of liver. That is why it is given the name name liver 0. And here is the left kidney pain on this flank. Actually, you will have the 12th rib coming out like this on both sides, and just where the rib ends over there, there is below that region is the fleshy area. That is where this liver 0 and mucus 0 pain point will be felt. And for diabetics, this mucus 0 pain point, left kidney pain point is very, very important. Okay. And then, as I said earlier, the mucus pain point is inflammation in the intestines. Sometimes you may find it as back pain also. So here is the mucus pain point. Here is the mucus pain point over here, left of the navel. And behind it, you can have back pain in that region. That is also mucus pain point. So when you know this, then you can understand why the problem is in the back, it seems to be in the back, but the solution is from the front. So if I know how to remove, suppose somebody comes to you with pain in this region, or this region, then you know you have to, if you know how to stimulate the liver 0, mucus 0, then your that pain can be reduced. Okay, he is coming to you with pain of his back. But in neurotherapy, what we say, treat his kidney. So now with this knowledge, you can also, when you do your other therapy, you can use this knowledge. On a day when you are not giving neurotherapy, you treat the kidney in your fashion. You stimulate the kidney point, whatever way you want, the kidney meridian. Okay, so that way, that is why I am saying, if you can learn how to correlate, then you will be successful both in your own therapy as well as with neurotherapy. And together, what is our main goal? Our main goal is to see that the patient gets the best result. This is what we are doing. Okay, we continue. So, and this is the pain of the appendix, the right ovary pain. So, this pain in this region is not only due to right ovary, it is also, especially pain in this region will be due to appendix, because that is where the appendix is located. Anatomically, the appendix is located at the lower end of the cecum, isn't it? So the cecum will come over here, let us say, or over here. So in this region, the pain will be due to appendix. Higher regions may be due to right ovary. We call it right ovary, left ovary. It also means right testes and left testes. Any problem with the right testes will manifest as pain over here. Any problem with the left testes will manifest itself as pain over here. But since more number of people, ladies, come to us with pain in these regions, so the name is retained because of the maximum numbers. Understand? So otherwise we can have we should say, for males you should say right ovary, right testis. For females you should say right ovary, males you should say left testis. When the treatment point is the same, why give different nomenclatures? That will only confuse the patient. Okay, so that is why, that not only patient, the therapist also. Because whether you say right ovary or right testis, the treatment point is in the hand. Whether you say left ovary or left testis, the treatment point is on the right hand. For right ovary, it is on the left hand. So that is why one name nomenclature is given. This region is called right ovary, or of course appendix also. Appendix pain is more in this region. Okay, so understand, that is how this correlation you should understand. All of you, this you can take screenshot. I will just reduce this a little bit. You can take a screenshot for the time being. So please take a screenshot like this, and then you can later on you can expand it and all that. Okay, so So now we will go ahead. So we have covered, and this our region, it is pain due to lumbar pain is there. This is the lumbar region. I told you this will be approximately, because it's liver 0, mucus 0, this will be approximately the L3, then L4, L5, this pain over here, that is lumbar pain. It can be either due to the back, or it can be, as written here, it can be due to uterus problems, due to prostate gland problems, due to urinary tract disorders, or simple leftover pain also. So leftover pain may be over here or over here. So that is, the diabetics don't have pain over here most often. And so that is why this leftover treatment is of great use for diabetes. And of course, we also have a treatment whereby tailbone pain can be reduced, or even it can totally go away if there is no major fracture or anything like that. If there is no anatomically no problem is there, if small injuries to the tailbone, we have got treatments which can treat it. Okay, so all these things will be taught to you in our courses. Okay, and so any point in the back, we have identified the cause for it. Now you can take a screenshot over here like this. You can take a screenshot, and then any point over here, we have identified the cause, and we will be teaching you later how to remove it one by one. Okay, so you understand. So we have got treatments for everything. We have got treatments to help you, and this chart is of great use. Fine. Now we'll go ahead. I will stop this share and go to another this thing. Okay. So many people are looking very carefully, and they are following my class very carefully. I'm very happy. Fine. So now we will be telling you some points what you can start with for diabetics. This is not all. Remember, we have to will be giving you a big protocol, but then so that you should feel, those of you who are here today seeing the word diabetic challenge, if you are here for knowing how neurotherapy can help you in your disease, for them I will tell you one very simple point. It's simple, but it is profound, but it is related to the body pain point. Now, as I said, the left ovary region is over here. This is my navel. This is my navel. My navel is here, and then mentally this is my left groin. So mentally I draw a line like this, a 45-degree line approximately, and then anywhere over here you will have pain. Either it can manifest as severe pain, or some diabetics, because diabetes is a disease of peripheral neuropathy. So some people may say, I don't feel any pain at all. If they are having diabetes, it exists there, but they are not able to know about it. Why? Because the sensitivity of the body has decreased. When sensitivity of the body decreases, you may have burning sensations, many other sensations, but you may not be able to feel the pain when somebody touches you. So, and especially when you touch it, you may not feel the pain at all. So what you have to do for those who are diabetics, what you have to do is you have to lie flat on your back and ask your relative to slowly first touch that region. I have shown the region. The region, what is the region? 45 degrees of from the navel, a 45-degree line from the navel, not horizontal, 45-degree line. Okay, so that point, you go on, ask him to go on pressing gently. If he says, oh, it is hard as a rock, I cannot press, or it just goes a little bit and he says, I cannot press further, then that indicates that you are having problem over there. Understand? So now you have to understand how to locate that problem of pain. Then this is one correlation. So for diabetes, I said one pain point I'm telling you is from the left of the navel up to the left groin, middle of the groin. Okay, that you have a line over there, and that line hardness, stiffness, kadakpan, you'll say kadapan. So these will indicate that that region is not receiving proper blood supply. That's all. Nothing to worry. It may manifest as many other points, many other problems in ladies in different ages. That's a different issue. But it indicates improper blood supply to that region. So what we have to do? We have to only supply the blood over there. That's what we are doing. We have got 2-3 techniques. One technique is like a direct supplying of blood. Another technique is using the remote control. Like in TV, you can go to the TV and switch it on directly, or you can sit wherever you are and you can just press the remote. Both will work correctly, isn't it? They are not the same, but they will work correctly. Similarly, we have got 2 ways of reducing that stiffness in that region. So first I will teach you one method. And for this, I am going to take you back. I have taught you one method. I have shown you the video last week. The lady is giving 60 toe finger gall liver. Now this treatment is also good for certain diabetics. Okay, not all. For people who are having some problem with gallbladder, or for people who are having a little bit of diabetes coupled with high blood pressure, for them 60 toe finger gall liver is very good to start. But like that, what did she do? What did they do there? Like this, that lady is giving treatment. Exactly the same treatment you have to do on where you have to give now, because it is the left ovary and this is linked to the right little toe. The right little toe is linked to the left ovary region. That is the remote control. The direct control is another point. I've already shown you a little bit. We'll do that. But the remote control is the right little toe of the foot. So this is my right foot, and this is my right little toe, and this is where we have to give treatment. So I will just keep the foot over here. You can all see like this. So what I have to do, I have to just twist like this. I twist like that. 60 times I can twist. For some people, this area, they may have certain pain over here. They may have pain or they may not have pain. But that sometimes the flesh over there is too soft, because some water, etc., always keeps accumulating. For those people, you give only 20 toe finger, but you will repeat it into 3. So that will make 60. So what you have to do? You have to catch like this and then do 1, 2, 3, 4, 5, 6, 8, 9, 10, like that, 60. Then you put your finger inside like that and then do 1, 2, 3, 4, 5, 6, 8, 9, 10, 11, 12, 60. So 60, 60. Wait for a minute. 60, 60. Wait one more minute. 60, 60. Do this. Do this one time first. This 60 into 3, do it one round. Then ask your friend who checked you earlier and say, ask that person, please press again. And now they will say, oh, now slightly my hand is going inside. Earlier it was too tight. Now it is not so tight. So you have now got a yardstick. Later on, when you take when you measure the sugar, that also will come down. That is different. So this is something which you can all, maybe you can even try it today, all of you. In fact, I invite those who are really diabetic for just 2-3 years. You can do it in my presence. You can lie on your bed. You can ask somebody to, you can shift the camera and all that. You can show me if you want. If you want. Why? Because this is a practical class. Practical class, any amount of my telling, unless I see that you are doing it correctly, then the results will come like this. Otherwise, a little bit result may come. If the person is not able to feel properly, I can teach. See, now you have to press like this. Go a little bit slightly. Like that I can tell. Anybody who is interested or who has got this thing, you can raise your hand. Then madam will spotlight you, and then we can see how your relative is giving the treatment. Or you can tell the treatment you can do yourself, but the testing you may or may not be able to feel it. If you feel it, then you don't require anybody else. If you feel that place very hard or it's paining, then you don't require anybody else. Then you can do it on your own. But if you cannot feel the pain much, then you can take the help of somebody to find out how much deep your finger goes when I am pressing that area. It is some type of palpation, let us say. Palpation is a word used by allopathy doctors, that they are also having this thing. They have got palpation, auscultation, like that. They have different words. So this is something like that we can say, but its purpose and its methodology is different. Okay. So I repeat, 60 toe finger left ovary, it is called. This treatment is called 60 toe finger TF. I write TF for toe finger. And I said, what is toe finger? Your finger and his toe, or your toe, whatever. In your case, your finger and your toe. So it's called toe finger treatment. Of course, it's a crude terminology, but doesn't matter. A rose by any name smells just as sweet. You all know it. So 60 toe finger left ovary into 3 treatments reduces the tightness of that region. Slowly, that region, when suppose you repeat it 3 rounds after 1 hour or so, you repeat it, and you will see that, yeah, you are getting better, that place has become better. And not only that, immediately whatever symptom you are having associated with due to that region, lack of blood supply in that region, that symptom will become better and better. So you must, that is why you say, in this your symptom noting down your symptom is very essential. You have to note down your symptom. Understand? And when you note down your symptom and then you give the treatment, then you will see it's a wonderful treatment. Now then the next question will come. How long should I do this? Naturally, since diabetes is not wishful like that, wishful thinking, you will have to repeat it. Maybe after 3 hours, maybe after 4 hours. It depends from person to person. It depends from constitution to constitution. So, depending on that, you can do whatever this treatment. If anybody here is a diabetic for 2 to 3 years, is having border, even you don't have to be even a diabetic. They call you nowadays. They have one word, pre-diabetic. Even pre-diabetic, they can do it. They can do it. In fact, pre-diabetics may not have many other problems. So they may feel very easily the tightness. They may feel very easily the pain in that region. They may not have tingling sensation in their feet. etc. So it is very good, right? And then you will see the result. Okay. So now let me see if anybody has raised their hand. There are now 172 people who are, yeah, Ravindranatha GN. If you have any question, you can also ask me, Ravindranatha GN, or is it only for testing your testing? Okay. No. Now, are you able to, my video, I think I am visible. Am I not visible?
You are visible, sir.
Okay, fine, right. So this other video, this I am not switching on. Okay, because that's not going to give you help. So one of my videos is on. Okay, fine. Okay, so now Ravindranath ji, would you like
Please
to
raise
then,
your hand, sir. Ravindranath, sir.
Ravindranath sir, please raise your hand and I will keep in gallery view. Then I can see where you are. Mr. Mercy is there. Very good. I can't see Ravindranath ji. I cannot see you here. Yes, I can see you now.
Namaskar,
Right.
sir.
Yes.
Sir, here I'm having one basic doubt. Particularly, you are doing all your exercise in Padmasana sitting like that. But for me, particularly, I'm having this knee problem, means meniscus tear or like that.
Yes.
And doctor advised not to sit in Padmasana like that.
Okay.
In that case, how to do that? This one, whether we can sitting in chair, we can do.
You can see, I am sitting in Padmasana for my comfort. It is not
No,
mandatory.
sir, pressing you told, hand and thigh you have to press together,
Yeah, in the chair. That can be done easily on the chair. In fact, it can be done better on the chair.
Okay. That's what always you are doing Padmasana. For me, it is uncomfortable. I cannot sit in
No. Don't worry. Now, I will tell you one thing. This 60 toe finger gall liver that lady gave the treatment. No, if you take that treatment for about 15 days to 20 days, your meniscus tear will heal to a certain extent. It may heal even more. But depending on your age and your other, if you are having any other health issues, then it will take longer time. Otherwise, you can go on doing it. 60 toe finger gall liver will help you for your for healing that meniscus tear. In fact, we have seen cases where it has helped a lot. Yeah.
And then, particularly for me, I'm having this. I think most of the diabetic they will have this leg numbness, like that you will feel,
Yes.
For that one, anything you will future, you will teach like that, or
Yes.
what?
For leg numbing and all, you require, see, for that you require another person to give you certain treatments. I will teach the treatment. I will show you the video of how the treatment is to be done, but it may or not be possible for you to get excellent results with your own hand. See, it is only basically I have to increase the circulation to your hand, to your leg. But for that, if another person gives the treatment, then the treatment gets better result.
Another person means it is a healer or even our wife or son like that.
Absolutely, your own family member. Yes, they can do it. We will teach the appropriate treatment for your family member. See, for everybody, please understand, neurotherapy is such that family members have been learning the therapy for their relatives. If it is a paralytic, of course, our treatment, our therapist maybe will be starting the treatment, but later on we will teach their relatives. You please give this treatments on your own. Slowly you start giving, and then the paralytic gets benefit. But I'll add you one experience. What happens is, these paralytic people, they are a little bit, many of them, they are a bit anxious, or let us say, I don't want to use any negative word, but you understand. So they may or may not cooperate when their family member, especially if it is the wife giving treatment, invariably there will be more of unpleasantries shared, etc. You don't know how to give treatment, that person is giving better, etc. So all these things happen. But otherwise, we say that if you set aside your this thing, your all these thoughts, feelings, then you will get very good results with your own family members. Anybody can learn the this thing and give the treatment.
And then one more question.
Sure.
Sir, you told in a message you have put a daily participant like that it is there. Is it this separate group? Is it a weekly or how you are going to give like that?
See, what I meant is, if I teach a treatment, I am not going to be hand holding every day, isn't it? No, I expect what invariably happens is, unless the participant and his relative is convinced of the efficacy of whatever they are doing or whatever I have taught, the participation is not 100%. So what I meant is daily participation. I will also discuss this with Joshi sir and see how best we can do hand holding, whether we require another group, etc. That Joshi sir will let you know by and by. So definitely we want to see somebody who practices with me whatever I say for 10 days, then his result should come. What are his results? We should know. Now, how many years you are having diabetes?
I think more than 5-6 years.
More than 5-6 years. What is your sugar level with tablets?
Actually, I'm having this allopathic I am using.
Yeah.
This Amaril and Y-Bite 50 like that. Okay. Actually, if you tell this one story is somewhat different. I got this problem because of my 30 years back, this one, duodenal ulcer, this one operation.
Okay.
For that one, I am having certain food, my sugar, it will go other way, means low sugar it will happen.
Yes.
I eat idli, dosa, immediately after 1 or 2 hours, it will go this one, and then I will get a low sugar symptom like that. So if I eat other type, then it's okay like that. So that's why doctor is telling, don't bother about any food restriction. Whichever you are regularly you take food, that food only you take like that. He is advised, and don't bother about your level also. If you are happy, it is okay like that.
Okay.
So that way I am continuing the tablets.
Okay. So now you can take tablets and all, that's no problem. Only thing, as I said, let us see what is your sugar level right now, fasting and PP.
Fasting, today also I have seen, it will go 130. That's what I tell. If I take idli dosa, it will go to 80 after food.
Oh, that means the carbohydrate is actually stimulating insulin.
Yes. And then if I take other than idli dosa, normal rice with fried rice or like that, it will be some 180, 190, it will come.
So then that means you require supporting of the liver.
Yes.
Okay. So okay, we'll see. We'll work out how best we may have a group and all that. We'll work it out, and that Joshi sir will put it in the group, or Anusha madam will put it in the group. Okay. Anyway, thank you for your questions. Very wonderful, and thank you for participating wholeheartedly.
Okay.
Now, okay. Now, Rajeshwari madam, please, you can start. Rajeshwari madam, where are you? Can I see you?
Ma'am, please raise your hand.
Rajeshwari madam, please switch on your camera, then they can. You can't see her.
Yes, sir.
Yeah, where are you? Is your camera on?
Yes, sir. On, sir.
1 minute. 1 minute.
Yes, sir.
Yeah. Anusha madam, please spotlight her also, then we will see.
Yeah, she's in spotlight now, sir.
Oh, okay. I'm sorry.
Yeah. Good evening, sir.
1 minute. 1 minute, madam. Yeah. MS Rajeshwari. Yes, now I can see you.
Good evening, sir.
Yes,
3 years before also I have attended your session and all that. That time also I have done something, and after that I discontinued. For the past 15 to 20 years, I am having the diabetic.
Oh.
Now the sugar is, fasting is 103, PP is 130 like that. before 1 year, I have taken insulin, and the insulin has been stopped and the sugar has been regulated. I'm having 3 questions, sir. I'm having burning feet.
Okay.
That's also a sign of the less blood supply, isn't it, sir?
Yes, yes. What is
Yes.
your B12 level?
B12 level. That's also normal, sir. Everything is okay.
But you are taking methylcobalamin?
Yes, like that neurobion I am taking.
Yeah, neurobion. How many tablets?
1 tablet per day.
Oh, very good. That's all right.
And calcium sulfol and all that I am taking.
Yes.
That you told the 2 treatment, isn't it? Gall liver treatment.
Yes.
It is a permanent one if we do daily. And what is the duration of the treatment? If we do the course of treatment, the tablet we will reduce, sir.
Not now.
You
should reduce. You can reduce the tablet only after seeing the report. You should ask the doctor that now I am seeing this report and I am doing something with, you can say neurotherapy, but he may or may not understand. You just say, first find out how soon, because a 15 to 20-year-old diabetics, I do not know how long, whether within 10 days you can see substantial result, but you should be able to see the moment you start doing that left ovary treatment. The left ovary means the right leg. So along with 62 finger gall liver, for you will require probably 3 treatments. One is the liver treatment, which you already know from the group, from this thing.
Sir.
Then you will require that 62 finger gall liver. That is at different times you can give, and then this left ovary treatment. This okay. You keep
per day. How many times we have to do, sir?
One time is in. You do thrice a day.
Okay, okay.
And then you let me know. But again, because I mean, diabetic bodies, they react differently at different times. Make sure that you are not going into hypoglycemia, because you are going to continue your tablets, isn't it?
Yes.
So when you continue your tablets, so naturally, but you have taken 1 tablet and I am giving you another tablet.
Okay.
Isn't it? Now,
what you mean, sir? We have to stop the when we are following the therapy, we have to stop the treatment, medical treatment.
No. I am not saying you have to stop the treatment. You should not stop treatment, but you should keep monitoring. You take first. Don't take 3 times a day immediately. First take 1 time a day. Then monitor your blood sugar. You monitor before the treatment. You monitor after treatment.
Gradually, we have to reduce it.
Yes, gradually, of course.
Yes, isn't it, sir?
And more than that, you should make sure don't take any of my treatments. If you are taking a tablet in the evening, then don't take a treatment after that. Don't take any neurotherapy treatment till early morning, because you see, in night when you are sleeping, you do not know if you go into hypoglycemia whether or not, you do not know.
How much time interval we have to give be given to the medicines and the neurotherapy treatment, sir?
I think 3 hours. See, it depends on how long how the medicine acts. Because you see, medicine
morning we are taking before meals 1.
Yes.
And then after meals we are taking.
Right.
And afternoon and night. Like that we are taking the drugs for the diabetic.
So every time are you taking? Every time are you measuring, monitoring?
No, sir. No, sir. Weekly once I will monitor, sir.
Then in that case, you should monitor. Do you have that kit at home? The self kit?
Yes, sir. Yes, sir.
So then when you are starting this treatment, before the sugar, before the tablet, you measure the blood sugar. After tablet, you measure blood sugar and see whether it still requires a correction.
Twice a day like that we will do, sir? Monitor?
Yeah. Twice a day you can do, but then you must see whether you require the correction, then you take the treatment.
Okay, sir.
After about 1 hour, or so, you can take the treatment, and then you see the result. Naturally, because you see, because I am not with you, when all the time, no?
Yes, yes,
So
yes,
I
yes,
must
sir.
make sure that you
We
are
have to.
protected properly.
Yes, we
So I
have
given you
to remember your words. That's all.
yeah, that's true. Yes.
Sir, very good explanation, sir. Very
Thank you.
patiently you have explained everything, sir. So kind of you. Thank you, sir. Thanks
Thank
for arranging such a session to Lalita madam and Joshi sir, everyone. We are benefiting so much.
Thank you.
So
Thanks a lot.
thank you, sir.
Okay. Now, since there is no another query is not yet forthcoming, I would like to know how many people are here in this group who are having diabetes for 3 to 5 years, between 3 and 5, let us say. Please raise your hand. 3 and 5, between 3 and 5. Please raise your hand and then we will count. So we should know how many people who are diabetics have joined this session. So one person, Kirti, there are 2, Indira, Pratibha, Yogesh, and then there are 2, 3 to 5 years. So only 2 have joined. So now both of you, anybody else? I can't see anybody. Yeah, Madam Nalini, Madam, is raised her hand. No, I don't. I want digital hand. Okay, I will see now, because you see, otherwise Anusha Madam has to see from that. I can see only 2 people. Usha Madam, Usha S and Nalini K. So okay, you are having for. Then I will talk to each one of you. Now, Nalini Madam, you please let me know how many. What is your blood sugar and how many years you are having this diabetes? No, you are muted. Please unmute yourself. Yes, madam. No, please unmute your. Yes, now you are already.
I'm having for 4 years. I'm having, sir.
Okay. Okay, 4
My
years.
blood sugar is recently 109 fasting and 156 pp, sir.
Okay, 156 of course is on the higher side. 109 also on the higher side. Okay, and this is in spite of your taking tablets.
Yes, sir.
Yes. So then you can definitely at least one day in the morning when you.
Okay, sir.
Do you monitor every one or 2 days, or do you monitor only once a week?
Once in a while, sir, not regularly. I don't want to see regularly also.
No. So now this time, see, please, this time.
Okay.
I request you to listen to me this time.
Okay, sir.
This time, what you do before, now that you have seen recently, when did you see?
Last week, sir.
Last week. Okay.
Yes,
Then
sir.
last week you have seen, very good. Now tomorrow, suppose you are taking. At what time do you take your tablet?
Around 10 o'clock, sir.
10 o'clock. Okay. Yeah. And then do you feel energetic after taking the tablet, or you feel drowsy?
Nothing like that, sir. I'm normal.
Okay. And you don't feel any sensation, tingling sensation in your feet, nothing?
Nothing, sir.
Okay, nothing. Very good. That's a nice boy. Okay, no, it is good. It's good to see grandchildren.
My grandson.
It's good to see grandchildren around. Okay, so okay, fine. Did you have any other issue of liver, like jaundice in your childhood?
Nothing, sir. But whenever they scan, they say fatty liver, but no treatment.
They have said fatty liver. That's exactly what I wanted to know. You have given me the correct answer. So you must take this liver treatment. You must take regularly. Okay.
Okay, sir.
That means at least take it 3 to 5 times a day.
Okay, sir.
Okay, that you take, and then this leftover treatment which I have told.
Okay, sir.
That you take. Do you have belching sensation sometimes? Do you get belching in the gas?
Yes, sir. Too much, sir.
Then you will require this treatment, which I have seen. Please see here. You will require this treatment. This treatment.
Okay.
You remember
leftover, sir?
No. First, this treatment. See, I am showing in the screen this treatment.
No, I am not able to see, sir.
You are not able to see. Okay. You still cannot see me. See, like this, I am doing like this.
No, sir. Only your photo is there, sir.
No. Oh, my photo. That is there.
Check the screen monitor of yours. You are able to see yourself?
Yeah.
There only you will find sir also speaking.
No, ma'am. No, it's not coming. Okay.
You are seeing my other camera.
Photo only, sir. Yeah.
Yeah, that is another camera.
Okay.
Why then you are not able to see me? You can't understand. Okay, we'll see.
Please check in the recording, ma'am. Okay, let's explain.
It's better if you take the recording, then you can see. Everybody is able to see.
Now I can see, sir. Now I can see.
Very good. So yeah. Right. So, okay. So like this treatment first you should take. This is called CNS gas.
Okay, sir.
Okay. So this you should take. This you must see an earlier video, ask for the recording, and see an earlier video where this is given.
Yes, sir.
But I request all of you that if you have no problem, please remember with the videos, and then whichever video you want, you should ask madam and sir to give that. It's a very nominal sum they are charging. You should be able to give it. So like that, because then only you can see the treatment nicely. Okay, so you give this treatment. What is this for? This is for stimulating pancreas also, and this is also for stimulating the digestion. So removing your belching. So this is for removing belching. Okay. So this you will give. Whenever you are, that means after meals also you can do it. Whenever you are having this belching sensation, do this immediately. Okay, so you can use it as like a tablet, for antacid tablet, like that you can use it. Okay, then for sugar, as I said, you will do this treatment, this leftover treatment, this one. Okay, this you can do, and if you do like that, I think you should be able to get very good results. Okay, you do it for 1 week, and then you take the testing. You are muted. Please unmute yourself and then talk. Yes, no, you are still unmuted.
Post us to unmute, sir.
You are able to talk. Please.
Yes, now it's okay.
Yeah, that's right. So,
there will be a resound, sir.
Yeah. Can you? Yeah, so it's okay, fine.
So now both the screen me only, sir. Okay, sir. I got it, sir.
Yeah, so fine. So this is what you have to do.
Okay, sir.
So you to do this and let us know how the sugar is benefiting.
Okay.
One day it may come too much low. One day it may be wherever it is. One day it may even rise up. I don't know, because different people will have different cycles.
Result. Yes,
yeah. So that is why I say don't stop your medicine. Nothing to be stopped. Whatever you are doing up till now, you should continue to medicines. You are not to stop at all. Understand?
Okay.
So like then that way you can do. It will slowly you will get the benefit. Yeah. Now I see Kirti. So many people have now raised their hands. Wait a minute. India. Pratibha Yogesh Ranka.
Hello,
yeah.
Namaste, sir.
Namaste. Is it India or Indira?
India, sir.
Acha, India. Very good. Okay, fine. Yeah, please.
Sir, before
1 minute. Just 1 second. Yeah.
Sir, 10 to 15 years back, I got low sugar. Sometimes when I got tension or hungry long time, then I got low blood sugar. But in 2020, my mother passed away. That time I got corona, sir. That stress I got, for that stress, I got diabetes. 2020 October. I am taking 2 types of medicine, sir, Emril and 10 India G.
Sorry. Yeah, go ahead, please, madam.
I am taking Emril 2 times before breakfast and dinner, and before lunch 10 India 500 mg. So I want to get rid of medicine, sir.
Yeah, so don't worry. You come to the right thing.
And I am constipated most of the time, sir. At one time, not clear my stomach. So I am very difficult situation. Yes, sir. So please guide me, sir.
Yeah, I'll guide you. Since it is a stress related.
Yes, sir.
Since it is stress related,
yes, sir.
Many people have stress related diabetes.
Yes,
so
sir.
That is invariably at that time. 1 minute.
Yes, sir.
Are you following me?
Yes, sir. Yes, sir. 100%.
Okay. So since it is stress related diabetic, so this normally stress related problems, they benefit by this leftover treatment. So for you also the same 3 will be. Do you have belching?
Yes, sir.
Belching.
Yes.
So that means CNNS gas, all 3 sides you should take, which it's better that you take the video, check the video, CNNS gas, all 3 sides. Then you should take 1-point liver and you should take this leftover treatment.
Okay, leftover treatment, how many times, sir?
Again, as I said to everybody, I say, see, your constitution, how it responds, you will know. First you take only 1 round and one set. Take and immediately see the result. Because if it is already reducing the sugar a little bit comfortable, then the second round you should not take immediately. No.
Okay.
So it depends on your constitution.
Okay.
Normally, people with 15-20-year diabetics, they may not immediately get result also. That is also possible. But definitely when we are taking liver and gas only, these 2 will be supportive treatments. The gas only will, see, now you are having this belching problem, that will go away by gas only. When you are taking gas only regularly, that belching problem will be solved. Then liver treatment. Then all of you, those of you who have, please pay attention. If you are having sleeplessness, then please take serotonin treatment before going to bed, because sleeplessness is another reason why the belching comes, why the stomach is not digesting, why the pancreas is not functioning properly. Another reason is sleeplessness. So if you are having sleeplessness, so many people have got benefited by serotonin treatment. So you should take serotonin treatment. You understand?
Okay, sir.
So that is for sleeplessness.
Okay.
So,
and sir, I develop under eye bags also, sir, last 2-3 years. Under eye bags or face swelling because of diabetes.
So face swelling may be because the thyroid is working sluggishly. So that will give you another treatment after a few days. We'll give you another treatment that will reduce the face swelling.
Okay.
Okay. So not today. We don't want to tackle too many things at the same time. Understand?
Okay.
So let it go. Whatever I have said, these 3 are enough for the time being. Then we'll add more treatments. Now what I want you to do is write out all your symptoms.
Okay.
This face, like this puffiness, everything you write it out.
Okay.
Write out. And then as you are taking treatment, you will then find out what is becoming lesser.
Okay.
Or if anything is getting aggravated, please do let me know.
Okay, sir.
Okay, don't just like that. Stop, oh, this is getting aggravated. This is useless. Maybe it is useless, but for you at that time. But I must know, and then I will suggest that I will find out the reason why it is not working for you, and then I will give you the correct solution.
Okay.
Okay. So please take that. Okay. Now,
Thank you.
okay,
Thank
madam. Okay. Now, Kirti, madam, please. Kirti, madam, you can
Namaste,
lower
sir.
your hand. Then we will come to Teresa, and then after that, Sister Mercy.
Yes, ma'am, please.
Namaste, sir.
Kirti, madam.
Namaste, sir.
Yes.
Can you hear me?
Yes, yes, I can hear you. Yes, ma'am.
Sir, actually, my brother, he's also in, he also joined your class. I had sent you this link to him also. My brother's daughter, she suffered from diabetes and she is taking insulin also, injections.
How old is she?
जस्ट होल्ड ऑन मैं उनको बोलती हूँ कि ये अनम्यूट करेंगे आरना करके हैं यहाँ पर
अच्छा
ज्वाइन कर रखा है आरना करके उनको भी आप अनम्यूट करवाएंगे तो वो बात कर पाएंगी आपसे
जरूर 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 तो मैडम
मैम को करना पड़ेगा ना अनम्यूट
हाँ नहीं वो कर लेंगे वो मैडम ललिता
Please
मैडम
ask her to raise her hand.
Please ask Arna to raise her hand. Okay, in the meanwhile, we'll talk to talk to Teresa. Please lower your hand, madam, Teresa, and ask to unmute. Teresa, your camera is not coming through. So please switch on your camera.
So good evening, sir.
1 minute. Where are you? Yes, madam.
Good evening, sir.
Good evening.
Sir, thank you so much for treating cough and cold, blocked nose. I tried with Arthakala exercise. It stopped the block. And 5 medulla I did for coughing. It also worked extremely.
Great.
And
great.
Thank you so much, sir.
Thank you.
And
please write this information in the group so that other people, you write in that Ramchandran and neurotherapy and then write this message in the group. I will be very grateful. That is the way you can.
Sir, for diabetic, if they are having itching, is the same treatment for them also?
No, the diabetes itching is different treatment.
Acha, acha.
Now, Kirti madam, your microphone is muted. Please, can you unmute yourself? We will allow you to unmute. Kirti madam. Kirti madam.
Turn your video, Kirti ma'am. Unmute yourself. You are not
Hey,
muted.
you are still muted.
Unmuted your mic. Please,
madam, your microphone is not coming.
Yeah.
हाँ, unmute कीजिए ना. हाँ, आइए, अभी बोलिए. नहीं, अभी भी नहीं सुनाई दे रही है.
We are unable to hear you, Kirti ma'am.
Good evening, sir.
हाँ, good evening. बोलिए.
Sir, this treatment which you have just told.
1 minute. Who is speaking?
This is Ashima, sir.
Ashima. Okay. Ashima, please. Dr. Ashima Kumar. Yes. But where can I see you? Yes, madam. I can see you now.
Okay. Sir, this treatment is it's left ovary treatment. It's for ovary as well as diabetes or just for diabetes?
No. It is also for ovary. It is the code name given for people who are having pain in that region, the region of the left ovary. Okay.
So it will help in cyst also, ovary cyst.
Or that is
for ovarian cyst you have no, it can help, but you have got a different sequence.
okay.
So with that we have to give certain other points, and for ovarian cyst definitely we can help you. If you like, you will consult my sir, and then you can take me for a consultation, and then I will definitely help you.
Okay, sir. Thank you so much.
Yeah, कीर्ति मैडम, आर यू रेडी? आप जरा बोलिए ना, अभी भी आपके माइक्रोफोन अनम्यूटेड है. नहीं, योर माइक्रोफोन इज म्यूटेड है. हाँ.
Yes sir, now it is unmuted sir.
Yes.
Actually my brother's daughter is having diabetes. And he is not be able to unmute like that. He is not be able to hand raise also.
We asked her, madam told you that please raise her hand, then we can unmute, because she is not raising
okay,
her
but he don't know how to raise his hand. His video is also on by the name of Harish. Harish. Yes.
Harish, 1 second.
Yeah, here he is. Yeah, here he is. He has raised his physical hand. Yes, I can see. Okay, Harish, I can see you, sir. Mr. Harish. हाँ, आप अनम्यूट कर लीजिए. आपके पास एक माइक्रोफोन का बटन है, उसको प्रेस कीजिए. हाँ, नहीं आया था फिर चला गया. हाँ, आई थिंक यस, इट लुक्स लाइक दैट. अभी आप शायद
प्लीज कंटिन्यू.
हाँ जी सर, अब मैम आवाज आ रही है?
हाँ जी, आ रही है.
हाँ जी सर, मेरी गुड़िया है 10 साल की.
हाँ,
और उसके डायबिटीज है.
ठीक है. तो 10 साल की, ये अभी डायबिटीज कब से शुरू हुआ इसको?
2 साल हो गए सर.
तो जुवेनाइल डायबिटिक है वो क्या?
हाँ जी.
कितना फास्टिंग शुगर कितना है?
फास्टिंग शुगर तो नॉर्मल आता है सर, 120 के लगभग आता है. बिलो 100 भी हो जाता है.
हाँ.
बट आफ्टर दैट शाम तक, मतलब बीच बीच में उसकी 400-500 तक भी चला जाता है.
हाँ, तो ठीक है. जब वो 400-500 तो जाए, उस समय आप ये लेफ्ट ओवर, ये तीनों ट्रीटमेंट उसको भी कभी कभी बेल्चिंग आती है क्या? नीचे से गैस जाता है क्या?
नहीं,
नहीं,
बहुत रेयर है उसके बेल्चिंग वगैरह, तो पतली सी है.
तो फिर उसको केवल लीवर दीजिए, लीवर का पॉइंट दीजिए, और ये अपना दूसरा लेफ्ट ओवर ट्रीटमेंट दीजिए. पहले एक ट्रीटमेंट जब वो उसका शुगर हाई है तब दीजिए. ओके, तब दीजिए. जब शुगर हाई है तब दीजिए. और लेफ्ट ओवर ट्रीटमेंट 3 बार देने के बाद वेट करें, एक आधे घंटे वेट करें, फिर लेफ्ट ओवर ट्रीटमेंट दे. फिर देखे दो ऐसा सेट हो जाएगा, 6 हो जाएगा टोटल. तो उसके बाद आप शुगर को टेस्ट कीजिए. बिफोर एंड आफ्टर टेस्ट करना बहुत जरूरी है. तो अगर आप बिफोर टेस्ट करेंगे और आफ्टर टेस्ट करेंगे, तो फिर कितना कम होता है, ज्यादा होता है, जो भी होता है वो आप हमें बताएंगे. फिर हम और क्या क्या ट्रीटमेंट्स, बहुत सारे ट्रीटमेंट्स है डायबिटीज के लिए, क्योंकि अलग अलग कॉन्स्टिट्यूशन के लोग होते हैं, इसलिए बहुत सारे ट्रीटमेंट्स हैं. तो आप इसमें ये कर सकते हैं. ठीक है ना? और आप अपनी समस्या जो है ग्रुप में दोबारा मुझे लिखिए. हरीश, मैंने रामचंद्रन एंड न्यूरोथेरेपी, ये दोनों करके आप लिखिए ग्रुप में कि भाई माय डॉटर इज हैविंग डायबिटीज सिंस 10 years एक्सेट्रा. तो फिर उसको और क्या क्या मैंने हेल्प कर सकते हैं, मैं आपको सजेस्ट करूंगा. उससे आपको और ज्यादा फायदा होगा बच्चे को. ठीक है ना?
ठीक है सर. एक मेरे भी प्रॉब्लम रहती है.
यही ऐसे ही डायबिटीज की?
नहीं, मुझे कॉन्स्टिपेशन की और गैस्ट्रिक मतलब स्मेल की प्रॉब्लम है.
हाँ, वो जब हम अलग से बात करेंगे ना, तो कॉन्स्टिपेशन तो मैंने थोड़ा सा कवर किया था. अब हमारे पुरानी वीडियोस में से आपको मिल जाएगा. गैस के लिए भी मिल जाएगा. तो गैस के लिए बेसिकली CNS गैस वही, उसी को रिपीट कर सकते हैं. मैंने एक और वीडियो में किया था. आप जरा, मैं ये अपनी सिस्टर से पूछ के वो जरा वीडियो लोकेट कर लीजिए, या मैडम को बोल दीजिए, वो लोग आपको रिकॉर्डिंग दे देंगे. कौन सा दिन का रिकॉर्डिंग चाहिए वो सिस्टर बता देगी, तो उससे आप कर लीजिए, हो जाएगा. थोड़ा थोड़ा तो हेल्प कर सकते. फिर भी आप मैंने अपनी बेटी के लिए ग्रुप में लिख दीजिए, और रुकने के बाद हम उसको ये कर सकते हैं, उसको क्या मदद कर सकते हैं. 10 साल की बच्ची है, तो 10 कंप्लीट हो चुका है या 10 अभी चल रहा है?
कंप्लीट हो गया सर.
मैंने 10वां साल पूरा हो गया.
हाँ जी, 10वां साल पूरा हो गया सितंबर में, अब 11वां साल चल रहा है।
अच्छा ठीक है, देखते हैं इसके लिए क्या 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 कर सकते हैं, देखते हैं, ठीक है ना।
ओके सर।
उसका वहाँ उसका डेट ऑफ बर्थ भी लिख दीजिएगा, तो मैं देखता हूँ क्या क्या हो सकता है प्रॉब्लम। ओके
ठीक है सर।
ठीक है जी, नमस्ते।
थैंक यू सर।
ओके नमस्ते मैडम, थैंक यू। हाँ नेक्स्ट शकुंतला माथुर जी, शकुंतला माथुर जी, हाँ जी नमस्ते। हाँ
सर
बोलिए।
मैं
नमस्ते जी।
सर मैं 72 इयर्स की हूँ
हाँ
और मुझे पिछले 22 साल से डायबिटीज है।
हाँ
और पिछले 10-11 साल से मैं इंसुलिन पे हूँ। मैं मेटफॉर्मिन और बहुत सारी दवाइयाँ लेती हूँ। इस समय मेरा लास्ट जो मैं बहुत कोशिश करती हूँ, एक्सरसाइज कर रही हूँ, तो मैं HB1C मेरा इस समय 7.4 आया सर, लेटेस्ट।
अच्छा
जी सर। बाकी आप मुझे कुछ बताएंगे न्यूरोपैथी से, तो मैं एक्सरसाइज तो कर लूंगी।
नहीं तो हमने
सर आज का सेशन मैं लेट ज्वाइन हुई हूँ, मैं तकरीबन 8:20 पे ज्वाइन हुई हूँ, तो मैंने पूरा नहीं देखा है।
ठीक
मैंने
है,
आप
तो मैं आपको
लेफ्ट
बताता हूँ, कोई बात नहीं, अभी इसको रिपीटेशन बाकी लोगों के लिए भी रिपीटेशन हो जाएगा, आप जरा ध्यान से सुनिएगा। मैंने आपके लिए काफी ट्रीटमेंट्स चाहिए, लेकिन अभी जो एक शॉर्टकट में जो 2-3 ट्रीटमेंट्स में बताता हूँ, वो आप लेके फिर अपना हिस्ट्री जो है उधर लिखिएगा ग्रुप में, और फिर हम देख सकते हैं कि आपको क्या क्या और करवा सकते हैं आपसे। और इसका जो मैंने फॉलोअप क्लासेस ऐसे होंगे, कैसे करना है वो जोशी सर मुझे गाइडलाइंस देंगे, तो उसके हिसाब से हम लोग वो करेंगे। और उसके बाद डेफिनेटली मैंने देखो 15-20 इयर्स है, तो डेफिनेटली उसमें टाइम लगने वाला है, वो आपको भी पता है, मुझे भी पता है, लेकिन शुरुआत तो कभी भी करें ना। तो बोलते हैं ना, इवन ए डिस्टेंस ऑफ 5 माइल्स स्टार्ट्स विद द फर्स्ट स्टेप, है ना। तो चाहे 5 माइल हो या 50 माइल हो, तो पहला कदम तो आपने शुरू कर दिया है, ये बहुत अच्छी बात है। तो क्या क्या करना है, तो सबसे पहले एक, मैं ऐसे बैठा हूं, आपको अगर ऐसे बैठना नहीं आता है तो आप कुर्सी पे कर सकते हैं। तो क्या करना है ये देखिए, मैं यहाँ से ऐसे, मैं ये पकड़ लेता हूँ, ठीक है, ये उंगली से देने वाला हूँ ट्रीटमेंट, ये उंगली से, लेकिन दोनों पैर के मैंने हाथ की उंगलियों को खोल के रखता हूँ, और कहाँ से दे रहा हूँ, जहां से ये मेरे एंकल है, ये यहाँ से ऐसे जोर से दबा रहा हूँ। ओके
सर प्लीज कंटिन्यू।
क्या है, तो ऐसे दबा के, ऐसे दबा के ऐसे लेके गए और ये एकदम ये उंगली के नोक पर आए, और फिर इसको ऐसे किए, प्रेस डाउनवर्ड्स, प्रेस डाउनवर्ड्स, यहाँ 6 सेकंड के लिए रोके, 1-1, 2-2, 3-3, 4-4, 5-5, 6-6, फिर धीरे से उसको छोड़ा, अगर कुछ दर्द किया तो हल्का सा ऐसे कर लिया, फिर वापस दोबारा ले गए, ऐसे दोबारा इसको करेंगे, ऐसे करेंगे, फिर ऐसे होल्ड करेंगे नीचे की ओर, दोनों पैर का कर रहा हूँ, देखिए ये पैर भी हो रहा है और ये पैर भी कर रहा हूँ मैं, दोनों पैर इकट्ठा, तो 1-1, 2-2, 3-3, 4-4, 5-5, 6-6, फिर वापस 1-1, 2-2, 3-3, 4-4, 5-5, 6-6। इस ट्रीटमेंट का नाम है CNNS गैस गैस, ऐसा इसका नाम है। ओके CNNS गैस गैस, ऐसा इसका नाम। हाँ शॉर्ट में मैं लिखता हूँ CNG, तो ये आपको समझ में आ जाएगा, CNG बोलने से CNNS गैस गैस, ये वाला ट्रीटमेंट।
राइट सर।
फिर आपके लिए लिवर को मजबूत करना है, और आपको कभी गॉल स्टोन या पथरी वगैरह हुए थे क्या?
पथरी नहीं।
ठीक है, वेरी गुड, सो लिवर काफी है, आप लिवर को स्ट्रेंथन कीजिए। और ये लिवर वाला ट्रीटमेंट क्या आपको पता है, इससे पहले भी हमारा ये किया है, इससे पहले भी हमने, आपने मेरा पिछले क्लासेस भी अटेंड किया है क्या?
लास्ट टू लास्ट किया था सर, मैंने लास्ट नहीं कर। जी सर।
नहीं, लिवर तो बहुत पहले का है, आपने अटेंड किया, आपको याद है क्या लिवर का ट्रीटमेंट? नहीं तो कोई बात नहीं, कोई बात नहीं, मैं दिखा देता हूँ। देखिए हम लेफ्ट हैंड, ये मेरा लेफ्ट हैंड बायां हाथ और बायां थाई जो है, जांग, इन दोनों को यूज करने वाले हैं। मैं क्या करने वाला हूँ, इधर लेफ्ट हैंड में 3 जगह, आप पहले देख लीजिए, ये 3 जगह, 1 2 3, ये 3 जगह। और उसी समय मेरे को पैर में भी ट्रीटमेंट देना है, पैर में भी 3 जगह लेफ्ट जांग पे। तो कैसे करना है, मैं यहाँ दबाता हूँ और ये जो भाग है, ये जो भाग है, ये नीचे जांग पे रहेगा। तो ऐसा पहला पोर्शन यहाँ है और जांग में इधर। ओके, मैंने कैसे आएगा, वो ऐसे आएगा और मेरे को थोड़ा सा आगे झुकना है, झुकना है। और ये जो है मसल जो है, ये हमेशा अंदर की ओर इस तरफ आनी चाहिए। तो इसलिए क्या करना है, पहले हाथ को ऐसे रखना है और मसल को ऐसे खींचो और फिर ऐसे दबाओ और बोलो 1 1 2 2 3 3 4 4 5 5 6 6। ओके, फिर 1 मिनट, फिर 1 मिनट रुकना है। 1 मिनट रुकने के बाद हम पहले इधर हाथ किया लगाए, दूसरे हाथ बीच में देने वाला, और इधर थाई में भी पहला था इधर था, दूसरा इधर। तो ऐसे रखूंगा मैं और अंदर की ओर खींचना है, ऐसे देखिए, ऐसे अंदर की ओर खींचना है, खींच के दबा के 1 1 2 2 3 3 4 4 5 5 6 6। ठीक है, 1 1 गिन सकते हैं या 2 1 गिन सकते हैं, जैसे भी। ये तो सिर्फ अपनी जानकारी के लिए, 1 2 3 4 5 6, ऐसे 6 राउंड सबको करना है। फिर 1 मिनट रुकना है। 1 मिनट रुकने के बाद, और 1 मिनट के समय आप लंबे सांस ले सकते हैं, अनुलोम विलोम कर सकते हैं, जो मर्जी कर सकते हैं, लंबे सांस लीजिए कम से कम। तो ठीक है, तीसरा तीसरा क्या है, यहाँ ये पहला इधर था, दूसरा इधर था, तीसरा इधर। तो और इधर कहाँ, इधर एकदम घुटने के थोड़े नीचे, घुटने पर नहीं करना, घुटने के थोड़े नीचे करना। तो ऐसे रख के फिर उसको भी ऐसे हाथ को थोड़ा टेढ़ा कर लेते हैं, फिर ऐसे अंदर की ओर दबाते हुए 1 1 2 2 3 3 4 4 5 5 6 6। तो ये हो गया 1 पॉइंट लीवर, 3 बार हुआ। ऐसे ही और 3 बार लेना है। तो 1 1 मिनट के अंतर में, मुख्य क्या है, 1 1 मिनट का अंतर है। तो 1 2 3 4 5 6। तो ये लीवर का ट्रीटमेंट, ये दिन में जितने बार आप करेंगे आपके लिए फायदा है। खाना खाने के पहले कर सकते हैं, खाना खाने के 1 घंटे के बाद कर सकते हैं। आप कभी कोई तली हुई चीज खाने को अच्छा लगा तो उस दिन उसके आगे पीछे कर लीजिए, कुछ भी खाने के साथ कर लीजिए, जो भी आप करना है, आप जो भी आप खाना खाएंगे उसके साथ ये कर सकते हैं, आगे पीछे कर सकते हैं। तो ये बहुत हो गया, ये बहुत अच्छा हो जाएगा लीवर के लिए। तो ये दोनों हो गया आपको सपोर्टिव ट्रीटमेंट। पहला वाला था ये मैंने नाभि के भाग में, पैंक्रियास के भाग में सर्कुलेशन बढ़ाने के लिए, दूसरा वाला था लीवर के लिए। अब तीसरा है मेन ट्रीटमेंट फॉर डायबिटीज, और इससे भी बहुत सारे अन्य ट्रीटमेंट हैं, वो हम आप अगले अगले क्लासेस में जब इसका क्लास सेशन चालू होगा आप ज्वाइन करेंगे। ठीक है, तो उस समय हम आपको बता देंगे। तो क्या करने का, ट्रीटमेंट लेफ्ट ओवरी ट्रीटमेंट बोलते हैं। तो लेफ्ट ओवरी हम कहाँ देते हैं, हम ये राइट लेग पे करते हैं। अच्छा, आपने मेरा वो लेडी ने ट्रीटमेंट दिया था 2 फिंगर गॉल लीवर, आपने वो वीडियो देखी थी क्या? नहीं, आपके आवाज म्यूट है जरा आप, नहीं आप म्यूटेड है, आप म्यूट है।
सर मैं भूल जाती हूँ, मेरी एक तो याददाश्त बहुत कम हो गई है।
हाँ, कोई बात नहीं, कोई बात नहीं। ये देखिए, ये मैं बताता हूँ, ये देखो, ये दाहिने पैर के, तो आप आज का रिकॉर्डिंग जरूर ले लीजिएगा क्योंकि याद नहीं रहेगा। तो आज का रिकॉर्डिंग ले लीजिए, और पिछले पुराने रिकॉर्डिंग्स भी है, ले लीजिए आप, आपको फायदा होगा। उसमें जो भी पॉइंट बोला, बहुत सारे पॉइंट्स आपके लिए लाभ होंगे, इसलिए वो रिकॉर्डिंग्स लेना आपके लिए फायदा है। तो ठीक है, ओके। तो अभी क्या है, ये जो उंगली है, ये सबसे छोटी उंगली राइट लेग का, लेफ्ट लेग का नहीं, राइट लेग का, राइट लेग की छोटी छोटी उंगली को आपने क्या करना है, देखिए, ऐसे 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 घुमाना है। ठीक है, तो मैं ऐसे पकड़ता हूँ और वो कहाँ से घुमा रहा हूँ, एकदम जहाँ उंगली निकलती है, उंगली की नोक, मैंने नोक नहीं, सॉरी, ये जहाँ रूट, जड़ जड़, उस जगह पे मैं ऐसे ऐसे करने वाला हूँ। 60 बार करना है। 1 2 3 4 5 6 7 8 9 10 11 12, ऐसे 60 किया। फिर इधर उंगली के बीच में ऐसे हाथ फंसा लिया, फिर वैसे ही किया 1 2 3 4 5 6 7 8 9 10 11 12 13 14 ऐसे 60 बार किया। ये हो गया एक ट्रीटमेंट ना। फिर 1 मिनट वेट करने का, दोबारा इसी को करना, फिर 1 मिनट वेट करना, फिर और एक बार करना। तो ये हो गया एक कैप्सूल, एक गोली, समझे कि नहीं। तो ऐसे दिन में हर हर भोजन से पहले आप एक बार ये ट्रीटमेंट ले लीजिए। ओके, और फिर मेजर कीजिए रात को एंड ऑफ द डे में कि आपके शुगर कैसा है। नेचुरल है, आपको पता चल जाएगा कैसे चल रहा है। फिर आप हमें शेयर कर सकते हैं यहाँ ग्रुप में, ठीक है ना। और डेफिनेटली वो शुरुआत हो जाएगी, तो धीरे धीरे करके हमने जो जो बताया ये सब आपके लिए फायदा है। फिर आपको शायद आपको जरूरत नहीं है, लेकिन कुछ लोगों को थायराइड को स्टिमुलेशन करने की जरूरत होगी इत्यादि।
Now we are stopping all the doubt sessions because now sir will be announcing about the further future courses that is available. So please don't raise hands because the time is less.
Yeah.
Sir will continue with the further future courses which is available. Now, whichever course was taught to you, it is not yet over because this is just a free class. The main class is pending and it is about 3 to 4 classes which will be conducted from next Friday onwards. And the fee, everything is provided in the group. So please go and check in the group about every detailed. Okay. And about this particular session, which is going to continue, this is the future session that is going to take place after this diabetes challenge session. Okay. So please go through the session carefully. Thank you.
Okay, thank you. Now I am sharing. Yeah, go ahead. Share screen. 1 minute, please wait. Share screen. Yeah. Yeah. Okay, now. Yeah. So now about the neurotherapy course. We have got 2 types of courses. One is called the basic course, which will last about 6 months, and another is called advanced course, which will last about a year. So it is after doing the basic only you can do the advanced course. So the basic course is of 5 levels, and as I said, it will last about, course duration is approximately 6 months, and you will be added in a WhatsApp group. You will be added, and then the format of study will be PPTs, PDFs, recorded videos, YouTube videos, etc. Okay, and periodical mentoring will be held through WhatsApp group chats to address the doubts, and once a month live class for question answer session. Yeah, question answer session will be there. Other times, of course, you will be permitted to ask questions in the WhatsApp group, and we will answer your questions. And then the suggested energy exchange, because we are going to show you around nearly 250 to 300 videos, prepared videos, etc., along with lectures, etc. So suggested energy exchange is 5,000 rupees per month. That is, the entire course will be for 30,000 rupees. And then we have got advanced course in clinical neurotherapy course. It is duration 1 year, and that is suggested energy exchange 60,000 rupees. So this is also same rate. 5,000 rupees is not increasing only because it's 1 year course. That is why it is 60,000. And along with this, you have an optional 10-day internship or practical training. There will be limited seats subjected to availability, and that will be at the participant's expense. We have 2 locations. Hindi will be at Raipur, Chhattisgarh. English or Tamil will be at Guwahati, Assam. Okay, so these are, and language of instruction basically will be Hindi and English. Anybody who cannot understand, etc., for them we will definitely translate as and when required. Okay, and then if it is exclusive Tamil, then I said to 10 participants, it may be, I may need more because exclusive Tamil will require a lot of preparation. So it may not be 10, it may be at least 20 or so. 20 participants, if they come, we will see. That is at a future date. So syllabus is just showing you the syllabus, just like that. What are the classes? You have got learning objectives, then introduction of neurotherapy, about the founder, Dr. Mehra, then neurotherapy in newspapers. We have got so many newspapers covering neurotherapy at different areas all over India. And then what are the achievements and milestones? Then what are the beliefs of neurotherapy? What are the features, etc. Then we have got some facts worthy of following. That means lifestyle, general lifestyle for a healthy life. It is there. So all these things will be taught to you in great detail through videos, etc. And with PDF will be given at the end of the class, at the end of the course. Each level you will have a PDF after the level is completed. So you are very well protected. Our intention is to disseminate the knowledge to the maximum possible. So that is it. Then results of LMNT, we have got so many results in so many areas. Whether it is skin disease, whether it is diabetes, whether it is the heart disorders, anything you name it, the results are there. But of course, the time duration may be different for different people. And all of you, if you learn this, then it will be a good addition to your whatever repertoire you are having of either it is acupressure or acupuncture or PCM, etc. Whatever you are, this thing you are having, so that it will be a useful addition. Then we have also got a chapter which what are the treated diseases, the list is there. Then what is the treatment investigation and diagnosis method, what testing instruments which are used, necessary. We don't really require testing instruments, but then other people are using, so you must know about it, like that. Then method of duration of applying pressure in neurotherapy, similar to what you are applying 6 seconds pressure. There are some treatments may require more pressure, etc. Then locations are different. We have got almost 100 different formulas, more than 100 formulas, and more than 100 points. So we'll teach you all those things. Then this diagnostic point front and back, which I have already taught you today to a small extent. So that will be done in great detail. Then neurotherapy practical points. So it is all coming in level, the first level. Then like that, you have got first level. Then points of toe finger, the same toe finger, it has got so many uses in so many toes and fingers. So many toes. So all those things. Then related to navel and setting the navel, etc. Okay. Then how to relieve the pain point in neurotherapy. So these pain point which I have shown you, how you can remove it, what are the combinations which must be given to remove it, all those things are given. Okay. Then we'll still like that. Then our body, general information. Then the first level we speak about digestive system and their diseases, how to rectify. So by the end of this level, you will be able to treat abdominal pain, back pain, fever, knee pain, neck pain, headache, sugar, BP, all these things. So quite a good arsenal, but this is not all. More will come in the second level. And each level is approximately for 1 month. So you have got enough material, and we are teaching you a lot of material. And anatomy and physiology of the digestive system. There we taught you the pains, body pains. And here you are starting the digestive system, the role of neurotherapy in modern life, how to prevent diseases through neurotherapy. So you can see this. There's plenty more. So anybody who is interested in joining the course, we will give you a detailed the syllabus, everything I will give you, that will be shared. So then concept of acid alkali. Now neurotherapy has got a unique division. That is, certain bodies are acidic in nature, certain bodies are alkaline in nature. For example, diabetes, it is a disease of acidic in nature. Cerebral palsy and spasticity, it is alkaline in nature. So most bodies will fall under one or other main heading. So that how to do it, what is the concept, etc. Okay, what is the concept of blocked channels of systems, then acidic and alkaline foods. So this is maybe some of this is overlapping other systems also. Then neurotherapy preparations, what are the formulas we have to give, etc. Then why we are pressing for 6 seconds in neurotherapy, the main reason, like that. So that will come. Then factors of diseases and their treatments. The neurotherapy formulae. Formula means a sequence of 3-4 points done in a particular sequence. For example, I taught you a treatment called p-heparin. There you gave 8 pan, 7 liver, and 8 chest only. That whole thing is for stimulating heparin, like that. So all these things are there. Then level 3, we have got many other points. Then level 4 is there. So in level 3, you will be taught about the heart and blood circulation, endocrine glands, lymphatic system, blood, all these things will be taught. Then pathological examination, precautions. We will give you enough material that you can do. You can, on seeing a report, you will be able to understand exactly what is being said. So many people don't understand that. So that seeing the reports of course will come in great detail in our advanced clinical class. But even here a little bit we will teach you. Then body structure, we have got diseases for your heart and blood circulation, endocrine glands, lymphatic system, etc. So this is level 3. Then you have got level 4. What are the methods of checking the pulse? We are not using pulse like Ayurveda, but at least we are giving you some fundamentals, rudimentary. Then information related to practical examination, and then blood tests used in diseases, then various chemicals and substances, etc. So all these things are there. Medical method of viewing medical reports, medical terms definition, method and benefits of giving neurotherapy points, and all these will be in Hindi for Hindi people, English for English people. Yeah, but in the group you will have a mixture. So English and Hindi, both people will get benefited by the same classes. But I am telling you, it is available in Hindi and English. Okay, so you don't have to feel out that you are lost. Okay, then diagnosis and treatment questions, etc. Okay, all these things. Then gastrointestinal diseases, then related to objective questions, etc. These are all examination oriented. Always one system will be examination oriented. Then here you have got diseases of reproductive system, urinary system, psychoneuromuscular disorders, respiratory system. So like that, here you are having the 5th level, that is, we have got a lot of this thing, inorganic substances, etc., etc. Lot of material is there. So this is in general, and this is the syllabus for the basic one for 6 months. Okay, then for other this thing advanced, we will have different this thing. So basic course is of 5 levels, course duration 6 months. So anybody who would like and this is for teaching you and making you into a complete, full-fledged, holistic healer. That is my purpose. That is my motto, and that is why I am. You have seen my determination to share. For me, every student is always welcome to ask questions. I share and share. I give, caring and giving. That has been always been my forte, and my sincerity of approach you have all seen. So I wish that all of you take the benefit of these classes, and then rest Lalita madam will inform you. I'm sorry, Anusha madam will inform you. So Anusha madam, you can please take over and inform.
Thank you, sir. And please note everyone, these sessions, whatever the price is mentioned, whatever the fee is mentioned, it will change for us, our Joshi Kerala group. So we request you all to please participate in all the sessions regularly, because your attendance matters. So all your attendance and your interest for further courses will help you get more, discounts for these courses. So please note, sir will help us regarding the same.
Sure.
Yes.
Sure, we'll discuss with Joshi sir, and then whatever, once we this thing, my idea is that all of you, if all of you join, then I am able to give a substantial discount. So please think it over And how many people are joined today? Let me just see right now how many people are there. 92 participants only. From it was started with 170 and now 165, at least 92 people. I'm thankful to you. If all of you join, you will get, I will be able to give you a substantial discount. Whatever Joshi sir will decide, it will be given, because I have told sir, I am there for each and every student and for Joshi's Kerala group. I want to give my best, and you will see that the matter is really superb. So many videos, so much material. So I thank each and every one of you who are staying back till the end. You 92 of you, you are my stalwarts, my heroes. So I thank personally, individually and personally, I thank each and every one of you. So, okay, now.
And now please note that there is a coming session, which is of 4 sessions, and it is only specially for sugar, that is diabetic patients who have been suffering from past only 3 to 5 years. Because this is a challenge kept for them, so that whatever is told to them, they have to continue it and they have to do it as, you know, as a daily routine, as a ritual, so that it can, you know, benefit them in many ways, not only sugar, but whichever the root cause was, it will go there and treat that person also. So it has not on one benefit, but many benefits. You might be finding that many other side effects which was going on for you, that also would be treated just with this particular sessions which you're going through and following. So we request you to please go through all the sessions, and as announced, all those who had been regular to the sessions, your attendance is noted. So all these regular attendees who are interested, please raise your thumbs up in the particular message which sir had announced, Joshi sir has announced in the group, because we would know how many of you are interested and how many of you can be, you know, earning your 1000 offer, because actual course fee is 2000, but you'll be only paying 1000 rupees if you're a regular attendee. So see how good the attendance could help you. So we request you very kindly and humbly to please regularly attend, make notes, and stay in the session. So because you might be missing out many things if you're not in the session till the end of the session. So please stay. And please go through the, go back to the group, go through the messages properly, and please put your thumbs up for whatever courses you are ready for. Because we would know, and we can accordingly, will be giving a challenge for you, which you have to follow. So we'll be guiding you throughout the sessions. There'll be only one session, but the guidance will be there in the WhatsApp group and whatever groups that will be from thereof. So please be there and please put your thumbs up. And those who had questions, please remember you have to put at Ramachandran sir, Ash Neurotherapy, and put your question, query. Whoever have been not answered in this session can go back to the group and ask your question, saying that at question and put your question. At query or at problem or at health problem, whatever it is, you just put it and please mention at Ramachandran sir, so that he can check it out, because there are so many healers in the group. Ramachandran sir won't know whom you have addressed your problem to. So please note, mention at Ramachandran sir or Ash or at neurotherapy, at your health problem or at your query. Okay. So that we can understand, sir can go through and answer you back. So thank you so much. And again, we'll be meeting with the next future sessions, which are paid sessions. So please note that you have to attend, pay. You'll be then, sharing the screenshot. Then only you'll be further attending all the other sessions of neurotherapy. Okay. So please make note and please see the group, watch the group. Keep typing in all your feedbacks in the group, mentioning at Ramachandran sir, so that he can know how good you have done all the lessons from him, taking it from him, and how good you have practiced it, and how good it has helped you in your overall healing. So we all wish you all the best for every session, for your good health, as always. That's why all the trainers are here helping you to heal yourself at home, sitting at home. So you are just sitting comfortably at home and attending all these sessions. So please note that, and please attend all the sessions. Share your feedbacks after every session, which is very helpful for each trainer. Okay, so please go through the group for all the sessions, attend it on time, 5 minutes early. And now I'm not going to, answer anybody. So please go back to the group and ask your query. Manjula, please go back to the group and mention Ramachandran sir and ask the query. Sir, please now continue with your blessings so that we can finish the session. Thank you, sir.
Sure. Thank you. Thanks to Joshi Kerala group. Thanks to Joshi sir and Anusha madam for guiding us for all these things. And now may God bless each and every cell of our bodies with health, happiness, harmony, peace, prosperity, and success. May God bless each and every cell of our bodies with health, happiness, harmony, peace, prosperity, and success. Thank you very much, and have a good night, have a good sleep, and follow my instructions. Thank you.
Thank you, everyone. Please follow the instructions mentioned by sir in every session. And now I am unmuting you all so that you can share your vote of thanks. Please continue.
Thank you so much, sir.
Thank you.
Thank you so much, sir.
Thank you, sir. Thank you so much.